Clear Channel Broadcasting licenses.
Hey, it's Leah for Dr. Anthony Pinozo, the pain specialist located right here in southern Palm Beach County. If you or somebody that you know has pain of any kind, you need to call Dr. Pinozo today. Make an appointment to go in and see him. This man has helped tens of thousands. In fact, he has literally treated more than 70,000 patients at this point in his life. He's been practicing for more than 45 years, and this man is a genius. He's figured it out. He has the tools that no one else has. He's able to help all of these people without going on any type of addictive drugs. You won't have to go under the knife for surgery, and you're not going to have to spend months and months or even a week in rehabilitation. He has a huge success rate with people with scoliosis, migraines, derotation of the vertebrae, flat feet pain, shoulder diagnosis, lumbar pain, elbows, you name it. Dr. Pinozo has treated it, and he can help you today. Give him a call at 561-381-5800 and tune in this Sunday, 11 to noon. And now, here's this week's edition of the Dr. Pinozo Sports and Medicine Hour.
She's terrific.
Good morning, everybody, and hello, Dr. Pinozo.
Good morning.
We not only announces that she's a patient.
Yeah, she is. She knows what she's talking about.
Oh, yes, she does. Hi, Freddie. Hi, Linda.
Good morning.
And today we're gonna do a little something different. I'm a person that goes to doctors, and here's what I want to say to everyone out there who's listening: if your doctor said to you, "I'm going to give you Botox to get rid of your migraine headache," you come in every couple of months and I'll give you another shot. He didn't say he was going to get rid of the headache. He said he was going to help you with the pain of the headache.
Right.
And I told you that if you go to Dr. Pinozo, you will walk out of there with absolutely no more headache.
That is correct.
And
Yes.
never come back.
And never come back, no.
Now, let me ask you a question. Why?
Well, I know the structure of the body that's causing that.
Okay.
So we just treat it directly. That's all. There's no big secret to it. It's what it is.
And it lasts for, they never come.
Once you treat these things, right, and it's more ligament than anything else, then it doesn't come back. There's no reason for it to come back.
Well, you and I and Freddie have on drpinozo.tv. If you don't believe us, you could go there anytime you want and look at patients that have actually gone in for the service. So in other words, all these hundreds of thousands and millions of people that are suffering from this.
Well, the neurologists have lost it. They are not treating a cause or a structure that causes headache. Headache is a symptom.
Okay.
It's a referred pain. Okay. That's how you have to look at it. And once you know where it's from, you can treat it directly. Just like we do any neck pain or any low back pain, we just treat it directly because we know where the source is.
Ah, that's the key.
You got to have the source.
So in other words, when someone comes into you,
for a long time, I couldn't really treat it that well,
right,
because I didn't know what the source was. But then we did some research, and my son Paul got involved with it, and he said it works.
Yeah.
So that's what we do.
Well, we know it works, and here's something I'm offering everyone out there and who's listening to the show or has listened to the show. What we do is Dr. Pinozo actually guarantees what he's going to do.
Yes.
In other words, am I correct in saying that on the air?
Yes.
So now, everyone who's out there who's ever gone to a doctor, who's ever gone in for surgery, I know when you went in for knee surgery, folks, your doctor didn't say, "I guarantee this will be good."
Yeah, it can't be good.
No.
And once you get operated, well, you're shot.
I mean, I know people that have gone for one knee and then came to you for the other knee, and they never had to go in for surgery.
Yeah, some patients show me their knees have been operated and they work well, but
right.
I don't know how it can work well since it's like a hinge, It goes this way, but your knee actually goes like this.
Okay.
So I don't know.
Did you catch on the camera? He was showing it?
Yeah, I saw his hands go this way and that way. So Chinese.
Yeah. So in other words, when they do a knee replacement, it changes the whole design and function of the knee.
It does, and you have a scar there,
right?
Which causes problems, especially climbing steps. But why do it? It's a lot of. We treat these knees and like most of them in 4 or 5 sessions.
Right.
And it's all physician treatment. We don't send you out for exercise to a therapist or anything. We don't believe that they know really what they should know. And a surgery, you have treatment before and after.
Right.
So what are you gaining by doing that? Nothing.
No.
Now, for instance, most of the time, a knee, I used this analogy before. I measured my own knee, which was about 16 inches around.
Is that a normal size?
It's a medium size.
Okay.
I'm medium build.
Right.
Anyway, the scar tissue that causes the pain in the knee is only about 3 inches. So the rest of the knee is normal. You have to look at it in the correct, when they say bone on bone, it's only about 3 inches of the 16.
So what do you do?
So we just it's an inflammatory change, an injury. So it's a ligament outside the knee, not inside. So we just treat that directly. We use ultrasound on it. We inject it. We get the thing moving again, so that in 4 or 5 treatments, you're in pretty good shape.
So if anyone has knee problems and want to talk to Dr. Pinozzo, they could call the hotline 877-927-6969. That's 877-927-6969. And Dr. Pinozzo will be more than happy to talk to you. Or if you are embarrassed, you could always call Dr. Pinozzo at 561-381-5800. And he'll be more than happy to let you come in and look at you. I mean, to me, and I think most of the people that I know would never go under the knife unless they went in for a second opinion. And you know what? When you walk into his office and you see the 20 people that will tell you...
Well, it's new technology.
Right.
So if you want the latest in thinking with results, I mean, you want to try this. I mean, that's why we're having this show. It's an educational thing for you.
Well, Doc...
It's not always a surgery, cut the thing out. No, we don't want to do that. We want to refurbish what you have, so to speak, so it works better without a pain. But the pain is usually just a ligament. I mean, you can't think of the whole knee as being painful. It isn't.
Right.
It's just a small part of it.
So
that's the thinking that you should have. You try the latest in technology, which is what we have, and we guarantee the treatment. I mean, if you take it, you're going to do well.
Well, I mean, all the articles I've read, no one guarantees. And most of the people that I've seen who have knee surgery, I mean, these are friends of mine who are runners. They've gone in for the surgery and they can't run anymore.
No, once you operate a knee, you're changing the dynamics of how it works. We're feeding into the dynamics. In other words, we're making it possible to work better.
Right.
When you replace it or throw away a good knee like they do, why, it's just, it makes me sick when I think about it. So let's not think about it.
No.
Change the subject.
Well, the Journal of American Medical Association says there's almost 65 to 70,000 knee surgeries that should have been performed.
Especially when they take the cartilage out.
Right.
Do you understand what it does when you take a cartilage out of the knee?
I understand because
It changes the dynamics completely, and you never recover from that.
Really? I know. Now, they can't rehab because it's hard to bend the knee the way they used to.
Well, the rehab, is done by non-physicians. I mean, it's just, they don't really understand how the knee works.
They're like the gym guys that teach you how to lift weights. That's basically the same thing.
It's basically the same thing, and they're feeding into the problems that the knee has.
Right.
Instead of changing the dynamics to normal. So that's how you have to think. Now, that's a physician thinking. You have to bring it back to normal. We don't really cure anybody. We help the body
Cure itself.
cure itself.
So I know, in other words, I know you graduated Ohio State University.
Hey, forgot my Ohio State hat.
Woody Hayes, and you did your internship at Ohio. And what I always wanted to know, and I never asked you this, is
My residency I did in Ohio.
Residency.
The internship was in Philadelphia.
so what made you, a doctor who could probably have done whatever you wanted, what made you decide to do this type of work that no one does?
Well, it's really the way my mind works. It's more in the physics area, weight bearing, that kind of thing, and just applied it to the body. And you go back and you look at the anatomy, design and function. How was it designed? What it's supposed to do?
Right.
Why is it symptomatic? How do we get it back to normal? And that brings a whole line of thought that's just not taught. And But that's what we do in our office. I mean, we don't have any non-physicians treating.
Right.
There's only physician treatment.
Amazing.
And,
Amazing.
Yeah, it's amazing.
really is.
And we find out what's wrong on the first on the exam, and then after we treat it, we repeat the exam. Now, when I say we cure that in one that day, we're actually showing it because the repeat exam is normal then.
Right. And what's a rule? What's a rule in the office?
Leap in, limp in, leap out.
Right. And you don't let them leave that office until the pain is gone.
Yeah. Well, you're not allowed to leave the office until that pain is gone, and so if I miss it, we'll redo it.
Yeah.
But you're not going to go out. In other words, you're not going to spend your time and money in my office without getting something out of it.
That's amazing. You don't hear the. In fact, I know Jimothy, who's up there. He's been treated by Dr. Penozo. Freddie, sitting right across from me, has been treated. We has been treated. I've been treated. So when we talk, we're talking from experience.
Yeah, you are.
We've actually gone through that. And Freddie.
I was there Monday.
Yeah, I know.
To film the lady from scoliosis.
I want you to talk about that scoliosis now. That's so
Well,
important.
even before we get into that,
Okay.
there were people who he had just treated, a gentleman, senior, who had been seeing Dr. Penozo for a few months, I think. And you were treating him, and he said when he first came, he was with a cane, with a stick, and now he was walking without it. And he gave us a testimonial, and he said that he's never experienced anything like this in his life, and he's had a lot of pain in his life. I think the amazing story is if you sit in Dr. Penozo's waiting room all day with a camera, and you watch people come in and come out, and they'll tell you, this is, if you have pain and you're not here, you're just doing an injustice to you. But it was unbelievable. The lady from England is 90% straight.
When we first saw, when you first saw it, because Freddie's been doing what we always say to people: if you don't believe us, go to Penozo.tv, and Freddie has all those X-rays on showing before, after, and the lady talking about what she's gone through. I mean, my God.
Well, the other side of the story is the husband.
Yes.
The psychological advantage when you have somebody who's in pain and you live with them, they go through a whole change. Mm-hmm. He aged. Now he makes fun of the situation because he used to help her with a bra. Yeah. So she had a big hump on her back. So he used to call it the snapper. He used to snap the bar over the hump.
Oh, so you guys had a long conversation about this.
I did it all on him because I wanted to talk to how he felt. Sure. He said he no longer has to snap her. He doesn't have to do that anymore because the hump is gone.
That's amazing.
But Les, you got to see her. She was unbelievable.
I saw her 2 weeks ago.
She had a book. She reads. She exercises.
She's what, 89 years old.
89 years old.
89 years old. So she's had this her whole life.
Wow.
Yeah.
Because you have to get it at a very young age, and then it just increases as you age. But it only took us. She was here 1 week last year and 3 weeks this year. So in 4 weeks, we have transformed that whole body. And that's never been done.
It's amazing.
You have to understand how the dynamics of it. That's the way my mind thinks, anyway. So we figure out what the cause is and then treat it directly. But this woman, I mean, she is unbelievable.
She looks like she's in her 60s.
Well, if you remember, the first time we saw her, she had no makeup on. Her hair wasn't done. Yeah. And now when you see her, I've walked by her twice. The last time she said, what's the matter? Are you mad at me? Said, oh, my God. She had lipstick on. Her hair was done. I guess when you feel good and there's no more pain and you don't have that hump.
That's a typical reaction that I look for.
Yeah, that is,
on the second day, I expect these women to be made up. And
so why do all these...
And she's grown 2 inches less.
Oh, I didn't even know that. Wow.
2 inches. All her friends said, what is going on?
And why did they tell her in England?
At the age of 53, every doctor quit on her. Yeah. So you had to learn to live with the pain. She was so furious when I spoke to her.
I know.
That she wants to take all the data, and she wants to take the doctor. She wants to go back to London, and she wants to go to every hospital, every doctor over there. To call them all a bunch of lies to their face.
So why do we let this happen to this guy? 6 million people suffer from scoliosis. Why do we let this happen?
Well, it's because the teaching that we get in the medical school.
Frustrating.
It's very frustrating, but the orthopedic surgeons are really in charge of this whole area, and they ought to abdicate. They ought to get these people treated right. No surgery should be done on these. That's worse than anything. In fact, I just last week I treated a lady who had rods in there, and she had so much pain that she couldn't exist. I mean, so
Can't even touch
I
it.
took that pain out, and I said, "You got to get these
Rods removed.
rods out. Yeah, you got to get the rods out."
It's craziness.
So in other words, when these doctors are in medical school, I'm not knocking anybody. I'm just trying to understand so the people out there can understand why put the rods in and not say, look, let me see
Well,
if I
it's a
can
co-
call up somebody.
It's a conservative group, and that's what the precedent was. That's what you're dealing with.
So the rods, what do the rods do? They
Truthfully,
straighten
that's it.
Yeah.
It's precedent. You know, they're not allowed to do anything that's not approved in the previously. Otherwise, they're subject to lawsuits.
So a new
But I say if you
technique.
put rods in, you should be subject to
Yeah.
lawsuits. I'm just kidding.
No, I mean, when Freddie called me on the phone, he said, Les, you're not going to believe this. I said, no, and you know what? Again, ladies and gentlemen who are sitting out there, if you have a child that has scoliosis, let's talk about the children that you've actually helped with. That's even more important.
They go very fast, especially between 10 and 20 years old. They straighten up right in front of your eyes. In fact, we just had a 14-year-old girl who we just used ultrasound. But because of the analysis I did, the film, and I knew where it was causing this. And it happened to be one place, maybe two. Anyway, we just used ultrasound on that, and I showed the mother the how to look at it in the oblique light, and you could see there's a hump on one side and flat on the other side. Okay, after I treated her, there was no flat. It was even.
I mean, it's amazing.
And it come right in front of your eyes. I mean, you're looking at it, and it's happening.
What amazed me with anything, Freddie, and anyone goes through, is how did you come up with being able to do this when everyone else is doing rods and they're doing this and that, which I'm going to get into in a little while about those famous guys, those
Well, because it's cause and effect. You have to
Right.
think, and you have to have the right philosophy, the thinking part. Cause and effect. So why is that like that? Then you revert back and you're thinking, and what's actually there? I mean, it's only ligaments.
Right.
I mean, that's all this is, folks. It's just ligaments scarred down. And so once you understand how it works, then we go right at it. We put a shot in it, comes right out.
And the shot, I'm telling you, I've taken 3. Was it 3 or 2?
Well, it's just
three.
it's just a steroid that softens connective
Right.
tissue. That's all. It's a very small amount. The reason we do it that way is how do you get medication into these ligaments? You can't. It's very difficult. You have to have high doses, and so why bother? I mean, if you know where it is, go get it directly.
Well, that's the secret. That
that's
you
what I
find
think.
where it is.
Yeah.
That's
That
the
is
difference
cool.
between you and everybody else.
Yeah, and I could easily teach anybody if they want to learn it.
Well, yeah, because you're so busy now. I mean,
Why not? Why not add another career?
you know, it's funny. You know, it's not like the doctors out there, like a lot of people that come on radio that are out there trying to say, hey, he doesn't really need that many. He doesn't really need any patients. What we're trying to do is you're trying to educate people. You know, if you have a child that's suffering from scoliosis, you know, before you go in for surgery, all I'm telling you, just go over there for a consultation. He'll look at you and tell you.
This service is worthy of a medical school chair. I mean, it really is. This is very intricate work. It's a thinking process. It is. We do special films, by the way. I have a patent on a film process that we do. Nobody else does it, and it's based on the engineering, weight bearing, physics, you know, that kind of thing. And so that's basically it. We guarantee it. It's high-level stuff. Don't hesitate. Bring your kid in there. Get it done right.
If we did this with an 89-year-old, Frey, imagine what he could do with a 15-year-old who just got the beginnings of it.
Well, I interviewed somebody that he worked with.
Good.
That was 14.
Did we get that on Penosa.tv so you could see her? Or did we get that-
I haven't put it up, but I will. I
Okay.
can put the film up. But the interview was interesting because the doctor treated her twice. The first time, he did not do anything with injections. It was all therapy he gave her. And then the second time, I think you took care of a problem she had for a twist or neck or something. And she tells her friends, I mean, this is a 14-year-old kid that's very active.
Sure.
And she tells her friends, I don't want to go to any doctor. I don't need to. And he takes care of what I need, and he explains what he's doing, and he does it, and he doesn't let me leave until the pain is gone. And there you have it. And it's amazing.
Yeah.
So in other words, you said take 2 aspirins and call me in the morning? No?
Actually, aspirin's your best drug.
I know.
It's,
Yes, I found it out the hard way.
it's the best anti-inflammatory out there, and it's cheap. Take it. Don't take any other drug. No other drug's going to help you.
Like my kidney specialist.
Especially that Lyrica. Oh, my God, that stuff will kill you. Ugh.
Well, Lyrica. How about Celebrex and all those other ones? It's very funny. I listened to what he says. I said to my doctor, I said, a good friend of mine said, if I have pain to take aspirin, not Tylenol. I said, tell your friend he's right. He said, Tylenol has done more damage to kidneys than anyone.
It's funny because they used to say that aspirin was dangerous. Now it's Tylenol.
Oh, no, aspirin's not dangerous. Hey, the preparations today dissolve quick, so they don't sit in your stomach making you bleed.
Right.
I mean, drink a lot of water, get it out of there, drink pop,
Yeah, that's what they said to me.
Mountain Dew, drink Mountain Dew. It's really good for you.
And it'll keep you up a long time, right? Doc has his Mountain Dew and his aspirin he just took before he got on the air.
At least it shows this doc is real. He's drinking Mountain Dew. Unbelievable.
Well, it's funny. I always, because scoliosis seems to be something that he's really, really, really passionate about. I went and I did some research this morning. And again, folks, I'm not knocking orthopedic surgeons. I am not knocking chiropractors. I'm just reading what was posted by these chiropractors.
And if you want to scream at Les, call 877-927-6969.
And I will tell you just where I got the information, so you go look up yourself. So, hey, Doc, here's what they're saying. That they have a process, this chiropractor, I'm not going to mention his name, that he uses spinal restoration. I don't know how you restore the spine. I mean, I don't.
Restore it? I
Yeah.
don't know what he's talking
Spinal
about.
restoration.
Yeah, I never.
They put a new one in.
Then what he does is they soften the structure of the spine by manipulation.
That's a massage.
Right. Okay. And this isn't even a doctor over here, and he knows the answers. He says you have to warm up the region of the spine, like doing exercises that for the spine. And I don't know. I've been doing exercise my whole life. I don't know how to do that.
Well, it's he's thinking right, except none of that's going to permanently change it.
Okay.
Once you
can't-
lather.
You cannot get to the structure that's causing the curvature, the scoliosis. You can't get to it. It's in the middle of your body. How do you get to it? I mean, you can't.
So how do you do a spinal adjustment?
I don't know.
You
what
crack it.
Yeah.
Yeah,
I guess.
crack it.
But see, that's an injury in itself.
Yeah.
That's what they call it an adjustment.
So the worst patients I see are the ones that had a lot of manipulation. Their bone structure is everywhere. I mean, it takes me forever to get it right.
Really?
Yeah.
And how about this one? They use vibrations to send signals. Right for this one to the
Vibrations?
brain. Yeah, right. Those things. They vibrate the spine. This. Look, if anyone wants to see this, go to scoliosis.com. And it'll give you a whole list of these things, so it's not me.
Again, they're not talking about
Right.
the cause of it. They don't know what it is. So
How you vibrate the
how are you
spine?
going to treat that? Vibration in the spine, that's not a,
I never heard of that.
No.
Let's see what else. Now, they changed the gait, which they say is the reason why you have scoliosis, to isometric exercises to strengthen the spine and align it.
No, that's not true.
I didn't think so. Okay. So now, how do they get away with saying this when it's not true?
Well, because nobody challenges them.
Okay, so whoever heard this, doctors, you could
You know,
call...
when your general practitioner sends you to the chiropractor or the physical
Right.
therapist, he's lost control of the situation. He's lowered your standard of care. You have to send people to an MD who knows what to do.
I think that...
can't-
yeah.
So this is why they get power. The chiropractors get a lot of power because they're given jobs to do and they can't do it. So it's a mess. It really is.
I mean, to me, again, I am not knocking chiropractors. I've never gone to a chiropractor because I personally don't believe in
Turn the mic down.
believe in chiropractic. That's just me. I'm about to say all I know is I have friends that have gone, and they're in worse shape now, and they keep going back, and I'm trying to convince them that they don't need. I had a friend of mine told me to go to his chiropractor. He could fix what you fixed in 2 shots. Mm-hmm. Okay.
Well, I got a question. I got a doctor who's saying that high electromagnetic field. You got 2 magnets.
Excuse
And
me.
you put your ankle between the 2 magnets, and it increases the white blood cells. And I looked at this guy, and I said, okay.
Oh, no.
I mean, I didn't say nothing, Doc. I just stood there and looked at him. And he says, and this will cure infection, inflammation. I mean, what is that?
He's taking drugs or something. That's not true. None of that's true.
Well, there was a show on TV that did debunking all these things,
Yeah.
and they said it's the mind. People want to believe that that this guy could cure them, and what they had was they set up a kiosk. And if people don't believe this, you could go to
That's true.
Penn and Teller BS is called, and you could download
And
it.
tell a BS.
Well, they called it all BS, and everything is documented by doctors. There were doctors on the show, and they said the only thing a magnet could do is pick up paper clips or nails. And what they did was to prove that they were right. They took 2 styrofoam cutouts of a magnet, and they put it next to this lady's head for a headache, and she came back and said, "Oh, that worked." They believe
Psychosomatic.
Yeah, it's like the voodoo doctors. They actually believe that this works.
Yeah.
It's mind over matter, right?
Yeah, let's take another view of this,
Okay.
whole thing.
Okay.
You gotta look at it in total.
Okay.
When you have treatments like this, there's a time you're wasting time and money. But not only that, but you get worse.
Yeah.
So when you say, well, I've had this pain for 3 months, I have to go see a surgeon. Okay, now you really have costs that are high.
Yeah.
Hospitals are very expensive. I mean, you can spend one night in a hospital, it's $20,000, and they justify every bit of it.
Oh,
which I can't understand that, but
I got my bill with from Medicare, what Medicare had to cover.
yeah.
It was almost $25,000 for one day.
So, when you don't have something that really produces results for a patient, I think of it as is a patient abuse. If you can't cure somebody, you should not treat them.
Mm-hmm.
I mean, say I can't do it, and that's what I do. I mean, if somebody has something I can't treat, I'll just tell them right off the bat, no charge.
And you've done that, yes. I've been there in the office when you said, "No, there's something I can't really treat. Why'd you go see someone else?" No, and that's being honest. So we're going to take a break, and we're going to come back and we're going to answer some questions from different websites of people that want to talk to Dr. Pinozzo. We will be back in about a minute. Thank you.
Hey, it's Leah for Dr. Anthony Pinozzo, the pain specialist located right here in southern Palm Beach County. If you or somebody that you know has pain of any kind, you need to call Dr. Pinozzo today. Make an appointment to go in and see him. This man has helped tens of thousands. In fact, he has literally treated more than 70,000 patients at this point in his life. He's been practicing for more than 45 years, and this man is a genius. He's figured it out. He has the tools that no one else has. He's able to help all of these people without going on any type of addictive drugs. You won't have to go under the knife for surgery, and you're not going to have to spend months and months or even a week in rehabilitation. He has a huge success rate with people with scoliosis, migraines, derotation of the vertebrae, flat feet pain, shoulder diagnosis, lumbar pain, elbows, you name it. Dr. Pinozzo has treated it, and he can help you today. Give him a call at 561-381-5800 and tune in this Sunday, 11 to noon.
Dr. Pinozzo is a world leader in helping those who have tried everything to get rid of pain in the body. When surgery or pain medicines aren't working, Dr. Pinozzo is here to help. Range of motion increased over 65,000 patients that Dr. Pinozzo has helped. And now he's here to help you. Call the show now, 1-877-927-6969, and let him help you get on the road to pain-free health.
You had some really interesting questions that people posed on various websites. Can you?
Yep, we're going to do some of them right now. This comes from the website playgolf.com. John by the name of Paul said he watched 2 shows on the website and was very interested in learning more about how the swing can improve by removing pain in his lower back. He said he had a horseback accident in the lower back years ago, and it has changed his swing tremendously.
That's exactly right. And the lower back takes care of the swing.
And they're calling him already. We said after the show.
I said after the show, folks. Don't call during the show because we can't take another break now when he's right in the middle of something. Okay,
Yeah,
go ahead, Don.
and so you have to understand how the swing works. Now, we figured this out. I palled around with Bob Tosky for a couple of years, who is a preeminent teacher of the golf game. But the swing at the tee is actually a medical problem, and I'm trying to get that across to people. You know, when you have all these parts of your body have to work together to produce a swing, there's no way that the PGA professional is going to be able to diagnose that.
No.
They have no background in anatomy or physiology of the body, how it works.
Just the art of golf.
Now, they are more important in the after the tee, because now this is more of the art. Which club to use, you know, you have to judge a lot of things. That's the art of golf, but the science of it is at the tee.
Mm-hmm.
So we can fix any of these problems that people have. You have a question about a shoulder also, I think, in there.
Yes, I do right here. From the same website. I went to this site to meet other golfers and find people who enjoy the game as I do. To my disbelief, I went to the video area and saw your video. I have shoulder pain, and it hurts me to follow through with my golf swing. As I saw your show, I heard you say that if you can't sleep on your shoulder, you know exactly how to fix the problem. Please tell me.
Yeah, the problem with the shoulder is just a ligament, and it's not rotator cuff, and that's a ligament. And it's easily treated. You have to know how to do it. But in each part of the swing, when you're bringing the club up, there's a shoulder, could be a shoulder problem and a lower back problem. And going down is the other shoulder and a low back problem as you go through after you hit the ball. Now, you're going to have a lot of distance loss. You're not going to be able to hit it long if you can't, if your body parts don't move properly. And that's what we do. We fix that. And in fact, I've been getting pretty good at the golf swing, analyzing it. And we've been doing it for a while. We film these things, and before and after. And I mean, it's ridiculous. You look at it and you say, this is what it was before. Right. 10 minutes later, this is what you're doing now. I mean, it's really remarkable.
I sent
and
some.
I'm proud of it.
You should be proud, but I sent somebody in. I don't want to mention his name. And was having trouble with his back and his shoulders. You know what I'm talking about. And a relative of mine said, you got to go see Dr. Pinozzo, because he went everywhere. He came in, I think he got 2 shots the first time.
Yep.
And he went out the next day, and he was playing great. He said his handicap had to change, and they came back again, I think, for another shot.
Right.
And he hasn't come back yet.
No.
So I said, what's going on? He said, I have no pain.
Yep.
I guess
true. That is true, and he's no slouch.
No, he's a smart guy.
He's a very smart guy.
Oh, yes, he is, and didn't believe anything.
Yeah.
So,
as a matter of fact, you're right. He was very skeptical when he came in, and I had to go through all that. But I just charge on, you know.
Yeah, he kept on asking. Oh, well, we know another
do
person.
my thing. Yeah.
We know another personality. I can't mention his name. That had the same problem. You know, he asked you 1,000 questions, and then he gave you and said, "Oh, wow, gee." Yeah, I feel better. Can you fix my being bow-legged? Just come on in. So now, Susan, who asked this question, let me give you Dr. Pinozzo's number so you can call him at the office after the show. It's 561-381-5800. Now, the show is over at 12 o'clock. Make sure you call him around 12:30 so he doesn't have to drive with one hand on the phone. Okay, let me see. Now we got this call from Linda, who watched Dr. Pinozzo on Tumblr.com. And it's about scoliosis. She said she watched the show, Pinozzo.tv, saw the scoliosis commercial, and she said, my daughter has this problem, and I wanted to come in and see you. Is it painful to cure? I guess everyone wants to know that. Tell them. It's
not really painful at all. I mean, we do what we have to do.
Right.
We don't have to give shots all the time.
Right.
But the older you get, the harder it is. So you want to get these kids in their teenage years. It's very quick, and their tissues are very mobile. They move pretty good. So this is a cure for scoliosis. I'm going to tell you again, this is the only cure there is. And I figured it out on the research I do every day.
Well,
So
I'm sorry.
we'll show you that, and come in and get it. I mean, this is a gift.
Come in and see the X-rays. I mean, that's all you have to do.
I mean, knowledge is a gift. The people should take advantage
no,
of
it's
that.
just a gift. You're right.
There is no downside to this.
And she says, she's an anxious mom, and I can see by what she's writing.
Yeah.
She says, how many scoliosis patients have you treated? Do you really remember how
Oh,
many?
well, it's
A lot.
innumerable, a lot. I mean,
A lot.
Well, he's seeing a lot more scoliosis patients. People talk, and the people that talk have all been positive. And to us, that's amazing right there.
but see, this is not a good question to ask.
no.
I mean, I'm guaranteeing the work. What
Right.
more do you want?
Yeah.
I mean, you want to know if I did 1,000 of them. So what does that mean to you?
Well, I think she's
1,000
trying to let her daughter know that.
Well, I know, but you have to change your thinking on this. If somebody's going to offer you something,
I
at
mean,
least try it. I mean, what's the downside? There isn't any. You know.
here's what I tell everybody, because I can speak from experience. I would rather get the shot that he gives me than go get a shot for Novocaine.
and this isn't Novocaine.
I know, you know when you go in and you get Novocaine from the dentist?
Yeah.
It always hurts. I don't care what anyone says. He's always going like this with the cheek. It always hurts.
It hurts.
And he put, I think, 3 shots in my groin.
Actually, when we give a shot, you have a decrease in pain, not an increase.
Yeah, I had no pain. And the next day it's even better.
Yeah, it's even better. Yeah.
Well, that's because he's not offering a Band-Aid. You know, a lot of people go in, they
exactly
get
right.
fixed. You got to come back 100 times. He's not doing that.
I wish somebody would call me up.
Yeah, if you want to talk to Dr. Pinoza, I mean, we take any question. We don't have to,
Tell us a story.
we don't just say, oh, no, we're not going to. We take every question he will answer. He fears no questions.
877-927-6969.
If you didn't understand that, because he's from Brooklyn, 877-927-6969. The 2 boys from Brooklyn.
2 boys from Brooklyn.
Let's see, we got another one. I like this one from. This comes from Pinterest. Love the show and wanted to ask if medication is part of your cure. I only ask that because I'm looking for non-medicine treatment.
Well,
No,
there
we
you go.
don't prescribe anything.
There's a big sign in the office that says we
It
do
says
not
that.
prescribe any medication.
Yeah, people walk out on me too.
Oh, yes,
They
I-
read that note and they just walk out. I mean, they're missing the point.
Well, as you once
Getting
said to
cured
me,
is the point.
right? You once said to me, medicine works in
Drugs
the
is
head.
not going to do it for
Right?
you.
It doesn't cure the pain; it just works in your head.
That's right.
No painkillers here.
Yeah, no, he refuses. This Pinterest is bringing up a lot of interest to here's another one, Doc. Sarah, Dr. Pinoza, I saw the last 2 shows you posted on this site and went to your website. You're a miracle man. Is it true that Leah from Real Radio was treated by you? I have bad ankles, and my doctor says I need surgery. Well, before Dr. Pinoza answers that, before anybody does a commercial for Dr. Pinoza, if they don't have pain and understand what they're talking about, he will not do the commercial. He doesn't care if the Pope comes in. Now, talk about what happened with Leah. This lady listens to the show. Talk about what you did with Leah. You might not remember, but I remember.
Well, she had a pain around her ankle for,
Right.
I don't know, several months.
Yeah,
And she was going to get podiatry treatment
Correct.
with a boot and other things. And I watched her walk, and there was nothing wrong with that ankle. And I told her, I said, I don't think this is your ankle. It's got to be from somewhere else. So I examined her back, and it was a referred pain from the lower back. A lot of runners have the same thing, Achilles tendon, but that's from the back also. You cannot hurt an Achilles tendon. I don't care what you do. There's no way to do anything to it. It's so tough that, and it's easily examined. It's right under your thumb.
Right.
If it isn't painful, it's got to be from somewhere else. That's the diagnosis that we do, the process that we go through.
Well, why don't you say this to Sarah? If you're a listener of 94.3 and you listen to Leah talk, if you listened about, I'd say maybe 2 weeks ago, Doc, when a patient called up on the radio thanking Dr. Pinoza for what he did for his daughter. I mean, it was like you could hear it in the man's voice that he's gone. Talk about that. What happened with that man? Because that was something that was amazing.
Well, it was a knee, and she had a little contracture on the side, which gave put the leg out to the side a little bit. But that's all it was, and he was very, very happy because
Yeah, he was.
he found out what it was, showed him the whole thing and what to do for it, and he was very, very grateful, and rightly so. The girl was only 14.
I think he was so grateful. I mean, in this business that I've been in for a long time, he got the recommendation from Leah on the radio, and then was so amazed. And Leah gets this on her blog all the time. I mean, we know it works, and if you want, you can call up Leah at the radio station. She'll be more than happy to take your call. So if you really are interested in getting your ankles fixed, you could call Dr. Pinozzo at 561-381-5800. He'll be more than happy to make an appointment for you. And don't be surprised if Dr. Pinozzo actually answers the call, right?
I answer all the calls because I bring in people to that I can do quickly, and some take longer. So
Right.
I adjust that. But I wanted to talk about a new piece of equipment that's being advertised heavily, and it's round shaped like this. It's I forget what you call it now. I should have written it down. Anyway,
What does it do?
it's supposed to treat any pain you have in your knee, elbow, shoulder. So I went to their website.
I do that all day
The
long.
thing is $600 for this little piece, and then if you read what it's supposed to do and how it does it, it's just a light bulb type of idea. It just produces infrared. That's all.
Really?
And it doesn't do anything to you. I mean, it cannot cure you. And there's an announcer that says this is a cure for you. Don't believe it. There is no cure like that. You can't get cured by a light bulb.
Is he guaranteeing
You
the
might as
cure?
well just use a hot pack. Get a washcloth, put it in water, and put it on there. That's the same thing. Save yourself the $600.
And save yourself a lot of money, because I know what I did yesterday. I had nothing to do. I was sitting around. I went to the Tommy Copper website.
Oh,
My God, they got things for your head, they got all clothes, like, unbelievable. So look, folks, go. This show is to give you information. I want you to take an old T-shirt and 2,500 pennies and put them on there and wear it. You'll save $75 on a compression shirt.
there is no way copper can do anything. Now, if you really want to think like a physician, here's what you do.
Okay.
You put the copper on, then you test the blood for copper. And I guarantee you, there's no way any copper or any kind of metal is going to get through that skin. It's a barrier that nature produced, so it can't be affected.
Very.
So they're saying it can, and it's crazy. You cannot. So I wouldn't buy anything with copper in it.
Okay. So I hope that answered that question. Now we have Frankie, who says, you guys have a great sense of humor on the show. Makes me feel that my back hurts like hell. I'm sorry, Frank, I couldn't read it. His back hurts like hell. I can still laugh to get cured. I have scoliosis, and I gave up trying to fix my situation. I went on your website to see you help someone straighten up. Is this true? Can you help me? Well, yes, it is true. I could attest to that. And go ahead, Doc. It's your...
Yeah, it's true. We've been talking about scoliosis, for a while now. So, yeah, sure. Make an appointment.
And if you want to make an appointment and you're really that interested, Frankie, in getting cured, call 561-381-5800, and the doctor will talk to you, and hopefully, I shouldn't say hopefully, once you see him, you'll understand how he can get rid of scoliosis. I mean, that to me in itself is amazing. Okay. Man, we got so many people writing in. Michelle from StumbleUpon.com. Great video, great show. Dr. Pinozzo, do you treat pain in the hand area like carpal tunnel syndrome?
Yes.
And why does it come? Okay.
Yes. Well, we don't know exactly why it comes. Probably a lot of use of the wrist. So there's a ligament that goes. Yeah, there's a ligament that goes across the wrist on the inside, right here.
Okay.
And that's what causes a compression of the median nerve there that goes to these three fingers.
Right. You see those fingers, Freddie?
I see him.
Put them back up again. I don't believe them. Okay.
Those are 3 fingers.
3 fingers, okay.
Doc got big hands.
Now, knowing why the nerve is affected by trauma to the ligament, right? Mm-hmm. Okay, so the treatment is to soften the ligament.
Oh, wow.
You don't have to cut it. All you have to do is soften it. And once it softens, you cause more room underneath it for the nerve, and it will recover. You might have to wait a little bit, but it does.
Well, let's
So
talk.
we do this routinely in the office.
Yeah, I know.
every
I
day.
see it all day
it's-
long.
But Doc, when you say soften, how do you keep it soft? It hardens
Well,
up
once
again.
you take the inflammation, no, it doesn't. Once you take the inflammation out, and we have to use a shot on this, because chemically you want to change that ligament. So it'll soften and lengthen, and that's what you want. That's the cure for that.
Wow.
Interesting.
Well, let's see. We've been talking about this a long time. Robert, who got you from livejournal.com, how many visits?
Wow, live journal.
Freddie, well, I'm going to.
We're everywhere.
Yeah.
We're going everywhere.
How many visits will it take to cure my migraine headaches?
One.
Okay, now, you said one.
One.
Okay. Robert,
O-N-E.
one visit to cure your
Or
migraine.
Un.
Uno,
UN.
no dos, just uno, right, Freddie?
Uno.
561-381. I'm sorry, 561-381-5800. And Robert, I guarantee you, he guarantees you, Freddie guarantees you, even Linda's here drinking a coffee guarantees, you will not have a migraine headache again.
That's right.
Hey,
Ever.
Doc,
Ever.
does Les know that you did a public appearance yesterday?
Oh, tell us about that.
Yeah, it was a group, and I gave a small presentation on what we do, and people were most happy to hear that because what we do is so unique to us, and it is a cure per place, and so we had a good time, passed out cards, and talked with everybody. It was great.
I think it makes you
If
happy.
I get invited somewhere else, I'll go.
Did they ask any questions, Doc? I'm curious about this.
He didn't ask any questions because it was just an introduce me, and
Okay.
It wasn't to cure anybody at that time. So, but they asked afterwards,
Okay.
after the meeting. Yeah.
And he's he's a nice looking guy, ladies, and he'll cure you. I mean, what else did you want? I mean,
I'm going to put him on DACA date.
Dr. Dave. Okay, I'm going to say again. Okay. How from VK.com. It's great to see a man come on the air and tell it like it is. You treated me 3 years ago. I love these. You treated me 3 years ago for a bad shoulder and elbow, and I only went to see you once. I now live in California. We'll be watching your show on the internet. If you read this email out loud, please tell everyone that as a former patient, I could play tennis, and I have no pain in the area you worked on. This man 3 years ago was magical. Now I see and hear he's still helping people. God bless you. And folks, he's telling you the truth. He does cure work. Wow.
Well, there you have another satisfied customer.
Wow. You know, folks, when someone takes the time to go on the internet and see the Dr. Pinozzo show at Pinozzo.tv and then write something like that, that means we're talking about someone real. I mean, you know, this is real. This is no games. This is no one trying to sell you something, and if you buy 2 of them, you get the other one for free. That's not what he does. Okay?
And if you called up the doc, then you made an appointment, you didn't show up, shame on you.
Yeah.
I mean, if you rather live in pain, then live in pain. But I want to talk to those people who want to get away from pain and actually do it without all the phony and baloney that's going on out there.
Well, the bottom line is that why live with pain? I mean, why? I mean,
It's cheap.
I don't know.
well,
It's
no,
cheap.
it's not really cheap because they take all they'll have the doctor prescribe Celebrex. It might get rid of the pain, but it's a Band-Aid. It doesn't cure the
What
pain.
about the doc? What about the guys that you've talked to that are hooked on painkillers?
Oh God.
That you don't even treat them until they get off the stuff, because I seen you telling you got to get off the painkillers before I see you.
I modified my approach there. I usually say to them, I will treat what you have. We're not going to prescribe anything for you. So wherever you're getting, if you want them, go back to them. I can't control human behavior
No.
that much. I can only advise them. So I said, look, we'll treat your pain, but I'm not going to prescribe anything. And so some like it, some don't.
Well, another patient I sent to you had two. One had tennis elbow, which he came in. That was the one's a sports guy, and he's not come back again. So I was on the phone. I said, "How's everything going?" He said, "He said his words were like this: Tell Dr. Pinozo I said hi, but I haven't had pain yet." In one shot. And he looks at me like, this guy's going to be a shot.
Yeah, this is true.
Yeah.
If you come in with an elbow like this, as I'm treating you, it comes straight like that.
That's a bent
Comes
elbow.
right down.
Yeah.
So this is a contracture, and I'm treating that, and it goes straight
Goes
down.
straight.
And doesn't come back up either.
Well, we have another person that might be on the radio very soon who has been going to chiropractors for the last 5 years.
Oh, buddy.
And I'm not going to mention his name because he'll yell at me because he's listening to the show. Went to Dr. Pinozo, I think, a couple of times. He fixed his shoulder once, fixed the other shoulder, and I think he did something. I don't remember what else he did. And he sent in another friend and cured him. They all look like, this really is amazing. I mean, they look like, no, to me, it makes me feel good because he's actually, you're curing people that I'm telling people to see. And it makes us, we've been on the radio now for over a year, and we still have not had one patient challenge us, or anyone out there that does what he does, because no one does it.
Well, I have a responsibility. If you're recommending my service, I have a responsibility to do it right.
Well, you do it right with
And we do
everybody. Yeah, I do.
Yeah. It's pretty routine now. All these things are routinely done: shoulders, knees, elbows, neck, headache, migraine, scoliosis. They're all have a routine approach right now, and so we did a lot of research on this. Believe me, this is not coming
I mean, you've been
easy.
doing this a while, now probably almost 50
And
years.
I have my son Paul in Phoenix does the same kind of work, and I check with him on all this. I tell him, why don't you do this, tell me what you think. And that's how we do this research. So,
and you go up every couple of times, and you
yeah,
sit
we
there
go
together.
out and we sit together. And
You know, it's funny. Those guys out there that do sports injuries and you get cut, and the team cuts you and says, you know, good luck to you, and you got to go out and you got to get whatever injury you have repaired, multiple operations and what have you. You know, give them a call. I mean, it's in your better interest. If a team cuts you and gives you a payout and says, here's X amount of dollars, which isn't a lot, and you have an ACL problem, and they don't want you on the team anymore, and they don't want to be responsible anymore because you signed a waiver, and you're out there looking for doctors, $60, $120 worth of surgery and then rehab, give Dr. Pinozo a call.
And you were a coach. You know all about this.
But this is what I'm saying, and I'm meeting an offensive coordinator by the kid that just got drafted, is going up to the University of Michigan. He's a lineman. And that particular coach is going to be on one of our other shows on Tuesday night. But even he said that he wants your number because it makes sense to come and see you in the long run with no injury
there
and
is
monies.
a good reason to do that. And one is that orthopedics don't do this kind of work. They do
Correct.
surgery. Trainers don't do this kind of work. They're not trained
They're not, no.
to do it. So that's why there's still whirlpool going on, and they wrap things. You know, they'll wrap things. It's just ridiculous.
And why these football players now with injuries are wearing that like cast or those?
Well, you got to know a lot.
Brace.
You have to know a lot about how the body presents itself with a problem, and you have to know about referred pain. You have to know how to examine what you have, and you have to have a commitment on the exam where this pain is, and it works. And then we do a special film that no one else does. It's my patent. I mean. I figured it out, and it's a weight-bearing thing. It's engineering or physics, which is why you have a pain in the first place. And what is it? It's a ligament. Where is it? That's the problem. Where is it? Once we find out where it is, then we can treat it directly, and that's how we get this cure rate that's very good.
Sure, 99% cure rate. Can't get better than that.
Well, Doc, I have a question for you.
Yes.
Go ahead.
There's a professional player in the NFL. He twisted his knee or his ankle, high ankle sprain. And they couldn't take x-rays because there was too much swelling in the area.
That's not true.
Well, they had to wait 3 days before they can x-rays. So he's out of commission now for 4 weeks.
Wow.
That's 4 games.
There's no swelling that stops an X-ray from going through.
But what are they looking for?
I have no idea.
So if you would have had this particular player, he probably would have
Well,
been
first
back
of all,
in a week.
they did not think he had a fracture. That's why
No.
they didn't take the X-ray.
But a gentleman like this with that much swelling, let's say that the thing looked like a balloon.
Well, we wouldn't wait till it goes down or use ice to get rid of it. We'd go and find the area by examination that is painful, the small area that did all that,
Cause
and then we treat it directly.
And there's a
then the
difference.
swelling goes right down. So you don't put ice on it. You don't do whirlpool.
They
you don't
waited
do
3
any of that.
days.
Yeah, they waited 3 days. Well,
It
I
got
don't
as
know.
big as a house.
So we would do it right away. I mean, if somebody had,
I mean, this is a huge human being. He was 368 pounds.
Yeah.
And he's a lineman, so he's constantly moving. So what we're trying to do now is we're trying to get those kind of ball players in.
well, they should try it. I mean, it's,
nothing to lose.
it's top of the line. I mean, there's no downside.
They're missing
to it.
4 weeks anyway with that kind of sprain.
Yeah. They're telling me a trainer knows more than a physician like
No,
me? I mean,
absolutely.
Come on, you
I
gotta
think
be
that
ridiculous. Yeah.
And I just can't understand why they're saying that it's a health hazard to put the kid back to play right away. I don't understand that
Who
either.
said? I don't know what they're
The
talking
trainer.
about. Yeah, the trainer, right. Yeah.
Well, you know what? To me, if I owned a football team and I could get my guy on the field that I'm paying $100 million to, I would definitely say, hey, it can't hurt. The worst side of capital just doesn't
I
fix
mean,
it.
does it
Can't
make
hurt.
sense to you?
No, not to me.
All these dollars go out, and what's your control over that person? A trainer? Come on. You gotta
Even
be
if you want to
kidding.
hold the guy out for a couple of weeks, at least you're doing it. He's in no pain. I don't get it. I don't get it.
I don't get it either.
You know, I can understand pain, you know, but to be able to cure the pain, to be able to never have it again. I mean, that to me, no one can guarantee. I mean, to get rid of a migraine, to get rid of an ACL pain, to get rid of knee pain, to get rid of joint pain, and never suffer again.
That's true.
I mean, when I went to, I couldn't sleep. My wife said, do not call him on Sunday. And now I knew if I would have called you on Sunday, you would have probably opened it, you know, because you're that kind of guy. And I don't know if anyone has the kind of pain where you can't sleep.
Yeah, I've had pain in my leg that I couldn't sleep.
And you had to go on a special chair. That's no way to live.
No.
I'm not going in for surgery for
Look at
that.
the lady from England, 53 years of age. That was over 20 years ago. They gave up on her.
That's amazing. That's amazing.
It's sad.
Well, I think the beauty of Dr. Pinozzo from my aspect is you care. That's the key. You really care about the people. You take your time to find the cause of that pain, and you fix it. And that, to me, is worth all the money in the world. Right, Jim?
You know, when you fix things quickly like that, you get busier, not less,
Yeah,
more.
you're pretty busy.
because people want to get well right away. They don't want to be going to the doctor. You know, not good
Okay.
for their life.
Got to wrap it up, Doc.
All right,
It
thank
always
you very
happens.
much, guys.
Thank you for tuning in. And we hope to talk to you next week. And the people that are ringing, you should have called up sooner. Have a great
Call,
day.
give his number. Hold it. Give his number. 561.
561-381-5800. 561-381-5800.
Now you can call.
Timothy, thank you for everything and have a great weekend.
Guys. We're out.
This has been the Dr. Pinozzo Sports and Medicine Hour with Dr. Anthony Pinozzo. If you spend 5 minutes with Dr. Pinozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pinozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pinozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pinozzo next week when he brings you more important information on the physics of weight-bearing and engineered concepts for the body.
Real Radio.